What do you think are some of the big risks that people are taking by going overseas to do surgery?
It's the aftercare, really. Surgery is 10% of the whole process, so if you're not assessed appropriately, if you have an online consultation before you go, not an in-depth reassessment. Sometimes you hear about the surgeries being added on the day of surgery. You haven't had time to think about it. And the aftercare, if you fly home a week after an abdominoplasty, the risk of deep vein thrombosis, any wound healing problems is difficult. And it's difficult to find somebody in the UK to look after you. If you have surgery in the UK, you would go back to your original surgeon. But if they're in another country, you can't really fly back that easily.
And you hear of warnings that the NHS shouldn't be dealing with the aftermath.
So yeah, it's a huge burden on the NHS. I've worked in the NHS and, we have patients who had Brazilian butt lifts, abdominoplasty overseas. Often these patients are perhaps not optimized. They'll be smoking pre-operatively, BMI too high, and perhaps the clinics where they go to have a lower threshold patients who they'll operate on. So actually, if you have a whole load of wound dehiscence, wound breakdown because you're smoking or because your BMI is too high, those patients then need to be treated back in the UK, and they're at higher risk of having problems anyway. I've had patients on the ward in the UK for 4 or 5 weeks afterwards, being treated with debridement, skin grafts.
So scary.
And who's going to pick up the pieces? You can't really leave those patients like that.
No.
They need to be cared for, and they're unwell, and potentially fatally unwell.